Hi, Dr. Scott here, and what we want today is, so iodine, now where we get iodine and what the body uses it for is basically when you get your thyroid hormone, iodine is one of the building blocks for that hormone. You see what happens, the body takes tyrosine, which is an amino acid, and then what it does is it binds iodine to tyrosine. So if the body takes iodine and binds 3 molecules of iodine to tyrosine, you get T3. If the body adds 4 molecules of iodine, you'll get the hormone T4. So that's basically where iodine comes from. And here's the deal though, like iodine, you don't need a lot of iodine. Like you could take the tip of a pen, okay? Well, I was going to show you a tip of a pen, but the tip of a pen is all you need for iodine per year, basically, to make thyroid hormone. So you don't need a lot of it, all right, first off. So with iodine, now what happens in Hashimoto's disease, the location that the immune system starts to attack is called thyroid peroxidase. And what thyroid peroxidase is, think of it, it's the glue that glues the tyrosine to the iodine molecules. Okay, that's thyroid peroxidase. And that's what the immune system wants to attack. So when these patients that have this Hashimoto's disease and they take iodine, what that does is it increases the thyroid peroxidase enzyme production or activity, right? More iodine in the system, and the body's like, oh, we better take it and bind it, take it and bind it. So it turns up the activity of thyroid peroxidase, which in turn turns up an autoimmune attack on the thyroid peroxidase. So for that reason, you really don't want to be taking iodine with Hashimoto's disease. Now there's a lot of research actually that's been done on this, and there's been different camps. So you have some people that wanted like hyperdose you with iodine, which I would not recommend. You don't need a lot of it anyway. And then there's some that want to reduce it completely. So, you know, with our experience and the clinical experience we have and the research that we looked at, what I'm recommending is if you have Hashimoto's disease, you really need to steer clear of iodine for the most part. Mainly because it just isn't worth the risk. There's been research that's been done that actually shows that these patients will have more problems and drive them into a hypothyroid condition when they're taking iodine. So you got to be careful with iodine intake. Now the factor is for a long time we used to be the opinion that, you know, a lot of the research is based on iodine supplementation, and that if you took it, you know, iodine in your food, for example, like kelp and seaweed and seafood, right? These sources of high iodine sources, where we were the opinion, we're like, yeah, you take it, the body will use what iodine it does, and then you'll be on your way, and it's not so much of a problem. However, there was a study that was recently done the last year or two, and what these researchers did, this is kind of crazy awesome actually, but they took Hashimoto's patients and they did 2 groups with them. One gave them iodine supplementation. The other one, they reduced their iodine intake to below 100 micrograms per day. You know, so what they found is they just reduced their iodine intake, and the conclusions on that study was that 80% of those people that reduced their iodine intake had a total remission of their thyroid symptoms. I mean, think of that, 80% of them thyroid symptoms went away. Quite amazing. So basically what's happening, you just don't, when you have an autoimmune condition, you want to eliminate the triggers that are going to turn that immune system to attack. And iodine happens to be one of the triggers that can turn your immune system on and attack the thyroid. So it just isn't worth the risk. Now, if you're sitting there and you're wondering if you have thyroid problem and if you have Hashimoto's or not, well, there's a good chance that you actually do have Hashimoto's disease, because Hashimoto's accounts for 90% of all thyroid cases in the United States. So with that, you know, most of the time we tell people to stay away from iodine for the most part, unless you know for a fact that you're iodine deficient, which is not too likely in the United States. But if you want to know if you're iodine deficient, there's a couple ways you can figure it out. Let's quickly run through your test. You can do a urine test, not very accurate. You can do a blood test, just takes time to do the test and draw it and get the results back. One of the quickest and easiest ways is to do a iodine patch test. It's like a patch of iodine that you slap on your arm. You leave it on for 24 hours. It's kind of color coded that shows the iodine, and what happens after 24 hours if the color's gone, that means your body absorbed the iodine, which means you're iodine deficient. If you didn't absorb it, then your body's good to go, okay? So there's a couple tests. There's even some online ones that you can figure out with that. So again, you wanna make sure you decrease these triggers. Iodine happens to be one of them, okay? There's other triggers. Hormone imbalances is a big trigger for a lot of our patients. In particular, PCOS, polycystic ovarian syndrome, is a problem. We'll cover that on another video about PCOS. However, even hormone imbalances can be an issue. Now, one thing that we're doing in our clinic now is we're actually doing pellet therapy for hormone replacement. Really cool stuff. You do a little pellet of hormone under your skin. You don't have to do anything for 3 to 6 months. It's amazing. Dosing is perfect. You don't have to worry about compliancy. Very, very nice for some of those patients that actually do need it. And hormone balances is something you need to look at on help when you're managing Hashimoto's disease. So anyway, hopefully this clears up the debate to a certain extent. Thank you so much. We'll see you on our next video.